I don't think people realize just how severe our crisis is. I have friends, colleagues, members of my hospital who cry before they come to work, cry when they leave work, because the workloads are so high. They are not providing the care that they were trained to give. We are morally injured, and it cannot continue. We need more nurses desperately. When you are waiting hours in any emergency, particularly when you're waiting with a child, when CHIO here was built to see 120 children a day and is seeing 110 in an hour, when you have to bring in the Red Cross, which is a disaster service, to help facilitate providing care to our children, what is it going to take for governments to realize that this cannot continue? Our most vulnerable are dying. In 2020, it was our elderly. In 2022, it's our children. Fortunately, we haven't seen many deaths, but how long is it going to be before it's a regular occurrence? And this is unacceptable. This is Canada. At times I'm lost for words as to why people are not listening. We've been shouting about this loud and long, and now it's critical. It's beyond critical. I've said before we're at the bottom of the barrel, but we're not. We're beyond that. We're below the bottom of the barrel. We scraped the barrel and we've broken through. So I don't know. I personally am, we're tired. We're working endless shifts. I have coworkers who've worked 12 out of 14 shifts. It's a regular occurrence to work 16 hours instead of 12. Vacations are not being granted. All these things speak to a lack of personnel and a lack of respect, because we're expected to continue to do this. Children are waiting longer for surgeries than adults. They're waiting longer for surgeries than is healthy for them. Children, our CHIO ICU is at 200% capacity. We are sending children who are 14 and above to adult hospitals. These are not adults, these are children. This is stopgap measures that are not doing our children and their families any favors. It is impacting their health negatively. They wait longer for mental health services. They wait longer for care in the communities. They wait longer for assistance, for rehab, for physio, all the things that we take for granted. Why is this? This is not acceptable. These are our future generations. These are our future. And we are penalizing them because they are small and have no voice. And we're penalizing your healthcare workers because we are burnt out, we are tired, and we are morally injured.